As future healthcare professionals, the question isn't whether we'll encounter mental health, it's how we are prepared to support it. Hello, everyone, and welcome back to the IPSF EuRO podcast. Today's episode is a special collaboration between IPSF EuRO and Mental Health Europe, released in recognition of the European Mental Health Week. This year's theme is Stronger Together, prioritize mental health in a changing Europe. It reminds us that mental health is something we support through connection, collaboration, and shared responsibility. In this episode, we're exploring careers in mental health pharmacy and how pharmacists can play a vital role in improving mental health outcomes. I'm really pleased to be joined by Ashley Yates, a mental health pharmacist who will be sharing his insights and experiences within the world of mental health pharmacy. So, Ashley, thank you so much for joining us.
Yes, thank you.
So to start off with, could you introduce yourself and tell us more about your current role within mental health pharmacy?
First, I'd like to say thank you for obviously having me on this podcast and get an opportunity to obviously share my insights and hopefully demonstrate to all your listeners what a great career choice mental health pharmacy is and how impactful we can be as pharmacists. My name's Ashley Yates, as you said, and I work as a clinical pharmacist at an inpatient mental health unit in a NHS hospital in Bradford in the United Kingdom. I've been in this role for about the past 3 years now. I graduated in 2019 from the University of Manchester. Moved through a couple of specialities and a couple of settings before settling in mental health. Unfortunately, I was a COVID cohort, so I was supposed to graduate and qualify in 2020, but I ended up being 2021 because obviously the pandemic that happened. In terms of my daily role, so obviously my essential core role is ensuring that all my patients receive safe and effective medical treatment for a wide variety of mental health disorders. Which covers inpatients and community patients, ranges from your normal dispensing, checking of medications and things like that for TTOs that you'd normally get on places like a hospital pharmacy, and giving advice over the counter, which is something that you see in a community normally. But I would also say that I'm really heavily involved in the MDT, and we sort of go around, we review the patients and whatnot. And we work in a large multidisciplinary team with consultants, physicians, nurses, clinical psychologists a lot as well, actually. Along with all your counselling and things like that. But I also do service improvement for my trust, auditing work and things like that, as well as like tutoring students and tutoring pre-regs. So I'm involved in the training aspect. In terms of like a day-to-day role, I might start off in the morning with like a morning huddle where we all get together and we allocate med recs to see who's coming over the weekend, any issues from the on-call, for example, that needs to be addressed for business for the day. We would then each attend our respective wards for what's called a PIPA meeting, which is like a morning daily meeting where they go through all the patients and see how they've been over the last 24 hours, including like mental state, any incidents that have happened and things like that. From then, I might do, pick and choose my ward reviews that I'm going to attend for certain patients, or if the consultant wants me at a certain ward review for a patient that might be quite difficult or challenging, then I'll go to that. And just sort of like time managing my day through that. Responsible pharmacist slots, each of us as part of our team. And obviously, we have a registered pharmacy at my hospital, so obviously legally it has to be staffed by what's called a responsible pharmacist, which is a legal requirement in the UK. So we do that, and that can involve assisting in clozapine dose changes based on what patients' levels are as part of therapeutic drug monitoring, or how they respond into treatment. We might change the doses. And also responding to community queries as well. So because we're a community trust, we get queries from like GP surgeries and anywhere in the Bradford district. It can be from dentists or anything. And we also help to provide services to other things that are under our trust umbrella, things like palliative care in the community, district nursing, offering advice to those as well. So it's a really sort of like varied sort of like, I can come across lots of different things with the community, inpatients, and not just mental health either. Obviously, you got to be involved in physical health as well. So it's a very broad range of things that I do.
Thank you so much for such an insightful answer. And yeah, it does sound like you have such a varied role and so many different things and so many responsibilities. You touched on it a little bit, but I wanted to explore more about the kind of patients you might encounter in your role.
Yeah. So we work with a load of different patients, and in mental health, it's it's normally split up into sort of like you have like in a cardiology ward, you might just have people with cardiology issues, and you'll have varying different problems. It's a bit more split up than that. So we have like acute male and female wards in psychiatric settings, and that's obviously risk prevention, because obviously people sometimes can be quite aggressive sometimes on certain wards, and splitting those people up is often a good idea because males tend to be physically stronger than females, so that it's just for safety reasons. We have elderly care wards, we have psychiatric intensive care wards, so that's a ward where patients might go if they are a bit too difficult to manage in a general ward, and maybe there's certain risks associated with aggression or self-harm and things like that. They will go there for more intense support. We have forensics wards, which is where patients attend there because they've, let's say, committed a crime or something whilst they've been unwell, and so it's just like an in between prison and a hospital. We have dementia wards, which obviously speaks for itself, rehabilitation wards, learning disability wards, and things like that. We don't have things like ETT departments. We have to refer out for those. And we don't have specialist wards like mother and baby units and things like that. Those tend to be like regional centres for certain things. But what we see is it can be quite varied. A lot of the patients that come into hospital tend to come in because they're harm to themselves or others. And so a lot of the low grade stuff that you might come across in the community, like maybe, mild anxiety and depression, we tend not to get those. We tend to get the people that are, so depressed, or they've been found at the edge of a bridge, or they're so anxious about something that they were refusing to eat, or, things like that, really. So we mainly see, your psychotic patients, your manic patients, and depressive, as well as getting dementia patients in, and quite a lot of what's called personality disorder patients, where emotions and behaviors tend to be out of line with what's tend to be acceptable in society, and that can put them at risk. So, like, for example, people with EUPD, for example, which is emotionally unstable personality disorder, they won't be able to regulate their emotions to certain stimuli. So, let's say me and you, if we were late to work on a morning, let's say we might be a bit frustrated and like apologize when we get into work. For a person with EUPD, that might be like the end of the world to them, and they have to think, oh, I must not go and self-harm now because of that. So it's about trying to navigate those problems. But yeah, we see a real large variety of patients. But we also have to deal with when patients, if like let's say they're on clozapine and they've gone to an acute ward, like a local district hospital, let's say for a medical emergency, and the ward over there want to know about how best to manage their mental health or how best to manage the clozapine, we also get involved in those kind of patients as well. So it's a real variety.
Thank you so much for your answer. It's very interesting to hear about the sort of nuances within mental health and how it's not so much the case that a person has one condition and that's all you're treating. It is a very, very much an all-encompassing area.
Yeah.
So what actually sort of got you into mental health? What inspired you to take this career path?
Well, I fell into mental health pharmacy, really. I didn't really choose it as a career from the start. I had initially wanted to do oncology or cardiology or nephrology, and I sort of hopped between all sorts of different ones. And it wasn't actually until I had gone through, working as a community pharmacist, working as a locum, working in outpatients departments, and working in acute trusts, that I looking for another job, and I got a bit, I thought to myself, it's time to move on. And one of the jobs that I went, when I was looking, was at my local mental health trust, and it literally came down to the fact that their job role was a permanent job role rather than a fixed term, and that's how I managed to get into it. And I also thought at the same time, like, mental health is something that I'm aware of, and I think as students, and especially as younger pharmacists, you sort of like, you view it as like a voodoo world where it's just like, oh well, I won't mess around with that. I know bits about it, but that's about it, really. You don't really get taught a massive amount in depth about it. And so I sort of thought to myself, well, if I take this job, at least I'll develop and learn a bit more about the field, and I can have another string to my bow, and I can be a bit more competent with my multiple experiences that I've got. And I'm so glad that I did go through with it, because honestly, like, in fact, compared to all my other jobs, I'm so happy that I'm here, and the way that you're involved in the team is so good, and I would really recommend people, going into the field, really. But yeah, no, I'm glad I'm in it now, and I think now I'm in this field, I'm probably going to stay here.
All right. Well, thank you so much for your answer. It's amazing to hear how passionate you are about mental health pharmacy. As you mentioned, it isn't something we touch on quite a lot here in the UK in terms of our studies, but it is a very niche area.
Mm,
And to see someone
mm.
so passionate and so like to advocate for the field is it's quite inspiring, to be honest. And speaking of the job itself, was there any specific training or experiences that helped you get into this role or that you needed before getting into the role?
No. So for me, when I joined, obviously I joined as a well in the NHS it's a band six, which is a junior pharmacist role. So I joined as a band six. I didn't have any prior mental health experience at all. My trust that hired me, we were part of the first cohort of junior pharmacists that they'd employed. They normally used to only take band seven or above who had mental health experience or were at least have done some training courses and things like that. So there wasn't really any specific experience or training that got me into the role, other than I would say being quite good clinically. I don't like to blow my own trumpet, but you have to know your stuff basically to some extent. And I feel like when I was applying for my job, they made me do a little mini clinical exam about mental health medications and see if I could like tick all those boxes. So I think my vast experience that I'd had and varied experience in previous outpatient clinics and acute trusts and things like that helped me get into it. But I mean, I trained initially in a community pharmacy, so it's not like I had any special ingredients or whatever to get into it. So I would say if there's any it's quite easy to get in. It's not an essential requirement for certain things.
Well, it's really interesting to hear that. So, for those of our listeners that are considering mental health and think they don't have the skills or the qualifications, it goes to show that you just need to take that step. And
Yeah, yeah,
more often than
absolutely.
not,
Yeah,
yeah,
if you
you
got to
will get
start
the training.
somewhere. You got to start
Yeah.
somewhere. Yeah.
Were there any sort of key moments that shaped your decision to sort of stay within mental health? And given your passion, something I think you're going to be staying in for a very long time now.
Yeah, I'm going to stay a long time now. Yeah, I mean, at the time, I had a friend who we both graduated university from who was doing a PhD in mental health. And I remember discussing, we often discuss lots of things with each other. I remember discussing with him, like, oh, I'm looking for a new job. I don't really know what to go for. And there was another job going a nearby city in the UK called Sheffield, at Sheffield Teaching Hospitals. And that was a fixed term, 3 year fixed term, I think it was. They had a diploma attached. And I was thinking, like, shall I go for this one? It's really close to me, and I've been offered a job there, and what should I do? And he sort of like talked to me about all the stuff that he was doing in his PhD and the things he was discovering and how interesting it was for him. It sort of convinced me to go with that route. I'd made my mind up anyway because I was like, well, it's a permanent job security. I'd rather go for that. But I suppose I could probably say that was the moment I decided, yeah, I'm going to go for this.
Oh, well, it seems like it's worked out for you, so it was a good decision.
Yeah.
Um, Diving into the role a little bit more, how would you say your role differs from a traditional community or hospital pharmacist role?
So obviously there'll be overlap. So there's obviously the typical regular dispensing medications, giving advice and things like that. But I feel specifically to mental health practice, I feel like I am a lot more integrated and embedded into the treating team and the MDT than I was in any previous roles. Like when I used to work on the MAU at my previous acute trust, it was always very much you were screening drug charts, you're doing meds recs and things like that. And then you'd go to the consultant and the treating team. You say, "Oh, by the way, I've got these suggestions. What do you think?" Or you want to clarify something, and then they would either address it or reject it or whatever they wanted to do, or take it on board, and then that was it. And then you'd go on to the next patient. Whereas in mental health pharmacy, you're in that team doing the ward rounds, and I know some places do that already, but it's very stark comparison. And I feel like the MDT rely on pharmacy a lot in terms of the treatment of the patients. You remember that, in mental health, the majority of treatments are medication based. You can't do surgery, that's not a thing. It's either therapies, psychological therapies, or medication, and or even better, both at the same time. And that means that you are heavily relied upon for your opinion. And obviously the brain is, it's the most complex organ in your body. We haven't even figured out the full psychopathology of a lot of these mental health conditions as yet. We've got some good ideas, and we've got some theories, and we've got some evidence for those theories, but we don't know specifically exactly why and what differences are between people. And you can't exactly do a blood test to check a biomarker to confirm a diagnosis of bipolar, things like that. Sort of, it's all about the skills of the diagnostician to make that diagnosis based on a history. When symptoms can overlap a lot of the time and they can present very similar, it's very difficult to then be able to choose the right medication. And that's where I feel like in mental health pharmacy, pharmacists are really well placed to use their expert knowledge and use that experience to sort of like really have arguments with the consultants sometimes and sort of come to a good decision between you two about what's the best treatment for this patient. And so, yeah, I feel like that's good impact that we can have. But I'd also say, in addition to that, in terms of mental health treatments, when they go into hospital, it can affect anyone and they can have all sorts of physical comorbidities. So you need to be a good generalist as well. So you need to be able to sort of like balance what you're saying and how they want to treat the mental disorder with the physical health side of it, because they might say, oh, I want this person on olanzapine. I think that's the best choice for them. And it's like, well, they've got a BMI of 40 and they are type 2 diabetic. So is that really going to be the best choice? And you've sort of got to weigh that up with the chances of it actually being successful versus is it worth the trade-off with the physical health. And it's about making those judgment calls basically, and taking ownership for your decisions really, and doing that. So that's why I think we differ really.
It's wow. So it goes to show that you're in a very unique position, I guess, where you're very much a valued member of the team. I think a lot of our listeners, especially those that have qualified or are a bit more in their early career pharmacy stages, can appreciate it's quite a task dealing with doctors sometimes and getting them on your
Yeah, yeah.
side. Would you say are some of the key responsibilities within your current role?
So I would probably say that my key responsibilities obviously involve around counselling patients in the use of the medications, helping to get them to understand their rationale. And it's about having the time to sort of like really go through medications with patients and counsel them on those things to help them get the best out of it in a system that, can very sometimes easily, if you're a patient on the receiving end of it, can seem a little bit like your people are making decisions without your say so, without your sort of like input. And so having them to sit down with them and go through the options with them and really get to know them and discuss them, that's a key responsibility that the pharmacist has, because we're the people with the medications, so, and we have the time to do that, which is really quite a privilege actually, to get to know people and make those, go through those things with them. And it would be obviously as well helping the MDT to make smart medication decisions and helping to keep with evidence-based practice. Unfortunately, sometimes when patients are presenting with behaviors that challenge and other things like that, there can be an attitude sometimes to just reach for medications sometimes when that's not always appropriate. And sometimes you have to be the advocate for the patient to sort of advocate for when deprescribing or when not prescribing at all is a good idea. I remember there was one chap on the dementia ward that I used to deal with, and he used to get up early in the morning and knock on all the patients' doors on the ward, and the nurses were constantly trying to give him rapid tranquilization, which is like uses of benzodiazepines and antipsychotics to try and calm a distressed patient down, which is really strange for a dementia patient because normally they get distressed on a nighttime, not on a morning. And we didn't actually figure it out. And I was a bit sort of restrictive of, well, I don't like the fact that we're giving him benzos every single morning. Not really, there must be a reason why he's doing this because it doesn't fit the pattern. And it turns out that for the past 20 years of his working life, he was a postman. And so in his head, he was delivering post. So we got around that problem. It didn't require any drugs at all. That wasn't the answer to the problem. It was giving him some fake letters so he can go around and deliver letters to the patients. And it's stuff like that where you really have to sort of advocate for the patient a little bit and step away and think really holistically. And I think nobody else on the MDT has that oversight as much as the pharmacists do, which I think is a real benefit and a real role for us where we can be helpful in mental health, really.
No, thank you. And thank you for sharing that anecdote. It's quite a unique example, but it goes to show again, it's not just in mental health pharmacy, but mental health pharmacy definitely gives you that aspect of don't always go straight to the medication. There might be another reason why your patient is
Yeah.
dealing a certain way or has a certain symptom.
You
So
see,
for
you
our
see it in other
students,
specialties for sure, but
yeah,
I think in
yeah,
mental health it's very blunt. It's very in your face.
yes,
This is an obvious example as the most extreme example as to that. So yeah, yeah.
yeah. Thank you for sharing that with us. Moving on to more of the challenges and rewards. What has been some of the more bigger challenges in your current role?
Obviously there's service level sort of challenges across the country, in the NHS as a whole, and I think this is true across a lot of Europe as well, but don't quote me on this. I think that there's huge pressures for demand and not a lot of supply, and getting those medication decisions right and making sure that the pharmacist is involved in that, to ensure that the patient can stay in the community well, takes a lot of that pressure off. They tend to get, and I know there's a big demand, but it's also not helped by inappropriate quick discharge or patients being given the wrong medications or not being counselled properly and things like that. And you end up with revolving door patients, which is one aspect of it. But I think mainly the main struggle in mental health in general when it comes to patients having poor outcomes is probably medication concordance with patients, and pharmacists having that opportunity to sit down and really discuss why they are taking or not taking certain medications, or any concerns that they have about side effects and things like that, can really help eliminate those problems. I mean, schizophrenia and other mental health conditions, they tend to take like 15 to 20 years off your life, because either you either have ineffective treatment and you don't want to take medications and you're killing yourself, or something happens, or you take your medications and the side effects of the drugs that we give you unfortunately increase the risk of things like heart attacks and strokes and other cardiovascular events and diabetes and things like that. So it's very important that we are able to get patients to take the medications and then manage those side effects appropriately, which is where I feel is one of the biggest challenges. I mean, there's a patient that I know who had been on multiple antipsychotics on the ward when I took over the ward. She wasn't responding to any of them. We gave her clozapine, and she turned around within about 3 weeks. She was well, and she literally, it was like a different person, and that was really nice to see. Initially, it was really good. She got discharged within a couple of weeks thereafter. That was like 3 years ago, and she's still on the ward. Well, she got discharged, and then she's come back in many times with relapses because she stopped taking her medications, because she's felt that the weight gain and the things, other side effects from the clozapine are just not tolerable enough for her. And that repeated relapse that she's had has caused damage, basically, to the point where now we're not able to get back to the point that we had previously 3 years ago. So even though she's on clozapine now, she's still symptomatic. And I think that's one of the biggest challenges, is because it's where you look at it and you think, yeah, we probably should have managed that a little bit better in the community. Thankfully, I'm not on the community team, so I'm not to blame. But you get my point, is that, these patients are being told to take these medications that cause these side effects, and they're thinking, why am I taking this? I don't really want to take this. And it's about the pharmacist getting a good grasp of their concerns, and trying to address those, really. I think that's probably the main driver in mental health, is patient concordance with meds. Yeah.
Yeah, I can see how that would be very challenging. There's only so much we can do in terms of giving a patient medication. It is ultimately the patient that has to take it.
Mm.
But as with many things in life, there's negatives, but there's also positives. So what has been some of the more rewarding aspects of this role?
I think the rewarding aspects, because obviously it's a very complicated field, and I think the most rewarding thing is when you get stuff right for patients, and when you see those initial turnarounds. So, for example, that clozapine lady I was talking about, I felt really proud and really satisfied with my job when we initially treated her, because we were like, oh yeah, this has worked, this is amazing. And I do see a lot of patients, obviously, in the community, and they're unrecognizable now to when they were on the ward when I used to speak to them. Like, I'm talking about patients who they've got such strongly held delusions about a certain thing, and they would be very difficult to shift. And then you see them in the community, and it's almost like I'm talking to you now, and you just think, I remember when you were like this, and so seeing patients overcoming that with the help of therapies and medications, and going out to live normal lives and getting on in society and having friends, and getting and living a normal life, basically, that's the most rewarding part for me, I feel like. Because obviously we're there to treat patients in hospital, we're there to treat patients in the community, but essentially, in a good way, I don't really want to see them again, because I want them to be out there living their life symptom free, basically. And so obviously that I'd probably say that's the most rewarding bit, is seeing that turnaround.
No, I absolutely agree. I remember one of the consultants on my ward, he says this is one of the only professions where saying I never see you again is a good thing.
Yeah, yeah,
Um,
yeah, it
so
is. But then I suppose
so
if for physical health, you'd be out of a job. So
yeah. But it does tie very nicely into the theme of this year's European Mental Health Week, which is we're all stronger together. And people with these conditions are humans, and they do have something that is
yeah,
not quite right with them, but that doesn't necessarily mean they can't live a normal life. And by coming together as professionals, as healthcare professionals, but even as friends and families, we can support
yeah.
everybody to sort of overcome.
Yeah, and I think as well, like when you say that, they are normal people. Yeah, they are. The number of times I've had to explain, like someone's asked me when let's say I've gone out with some friends or whatever, and so I get talking to people, and they say, "Oh, what do you do?" And I'm like, "Oh, well, I work at this place," and they often come back with a lot of like, oh, that isn't that the loony bin and things like that. And I just think, well, you can't really, do you know what I mean? So it's the public perception of those things as well. And people
Mm.
need to realize, because all they will ever see is people in the news of like, oh, this person did something really bad in the community and he was a paranoid schizophrenic and this, that, and the other. It's like, well, yes, that's a risk. It's not defined by it doesn't define the people. The same way anyone can have asthma or anyone can have diabetes, people might have schizophrenia. And that's what people need to realize is that, these are just people like you and me.
Yeah, absolutely agree. And now, so a lot of our listeners who are students or are coming towards the end of their studies and sort of thinking about their early career roles, is there any advice you would give to our listeners who might be interested in mental health?
I would say be open minded about it and be brave, because it is quite daunting at first when you go in, especially when you go in from my position, who didn't. Yeah, I knew bits about mental health, but I wouldn't consider myself like I wouldn't want to be making any like changes or anything. Like the extent of my mental health knowledge was interventions were things like, oh, SSRIs and NSAIDs cause bleeding risk, or if you're going to have a cardiac risk, you make sure you pick sertraline, stuff like that. Really basic things. And now I'm actually involved in it. Like it's a lot more complicated than that. So I would say if you are interested, or even if like you're not too sure about it, I would give it a try, give it a flavor, just do a bit of reading into it and see what you think. Because honestly, it is the depth of complexity and engagement it requires from pharmacy can be really rewarding. So yeah, I would say if you're interested, go for it. Be brave and have an open mind about it as well. Don't come in with preconceived ideas of what patients are or what might be going on or why certain people do certain things. There is a pathology behind a lot of it sometimes, but sometimes it's also about just that person's life story, really. So you just need to put that to the side and go in with an open mind and be a bit brave, I would say.
Absolutely agree. And in that regard as well, is there any specific skills or experiences they should probably be focusing on developing?
When I first joined, I found communication really difficult with these patients. I know we talk, if you're a community pharmacist, you should be well versed in this in hospital as well. Dealing with, various different people and learning how to communicate properly with them and making sure that you can get the right information across. And that is one aspect of it. But I would say that it's made 10 times worse because, you're going to be talking to patients who, I mean, I don't know if you've ever had a conversation with a manic patient, but you should try and have a conversation with a manic patient, because you will not be able to get a word in edgeways because they will just talk over you. I remember once talking to a manic patient who I wanted to start him on lithium. I said, oh, I've come to talk to you about lithium. And he literally, within the space of about 10 to 15 seconds, moved from the topic of, oh, lithium, that's a tablet, isn't it? And it's a metal. Oh, it's in this tablet, and holding up his iPad. Oh, this has batteries in it as well. That's got lithium in it as well, isn't it? Is it the same as? And he would literally go off on a massive tangent. And it was very difficult to like get really talk to him and ensure that he understood what I was saying and that he agreed to it, or that he understood the rationale as to why we wanted to treat him. And so the communication front can be really challenging in mental health, and you need to be able to navigate those kind of like awkward conversations that you might have, and that comes with practice, I would say. Talking to different people, just getting exposed. I mean, I really struggled with it when I joined, but I'd say I've sort of I'm getting better at it. I'm sort of mastering it now. So, but yeah, having good communication is definitely key, along with having good empathy skills and critical thinking as well. Because from an empathy point of view, you might have a patient that's really distressed or shouting and screaming, and you think, oh, why is that? Is it because they're responding to voices? Are they internally distressed about something? And it's not until you put yourself in their shoes that you think, oh, well, actually, maybe I would respond to them like that. So I've had instances where the nurses have gone, oh, can we give this patient, lorazepam? They're shouting and screaming about this. And then you start to ask questions, you dig a bit deeper, and you find out actually, well, no, they're shouting and screaming because let's say they're under section, they want to go and get some clean clothes from home, and they've been told in the ward review that they could go. And then when they've actually come to leave the hospital, they've been told, no, you can't go because there's not enough staff to take you. And things like that can lead to obviously distress and agitation. And it's about thinking, well, if I was in their shoes, I'd be a bit annoyed as well, consistently considering, I'm here against my will. And if I try and leave, I might get people are going to try and stop me. So I think it's having being able to put yourself in their shoes and see why, and then critically think, well, is this request that's coming to me from the nurse or the doctor, is it appropriate? Like, how would I feel? And so I think, yeah, communication, empathy, and critical thinking are probably quite imperative to have.
Yeah, thank you so much. A lot of the skills that you've mentioned are things that, as IPSF Euro, we host webinars, we have different competitions, we have different events like the LIT and TDC where you can learn a lot of these softer skills. So, if any of our listeners are interested in developing any of these skills, not just to go into mental health, but to go into any profession, then do keep your eye out at our social media. We always post when we have these events. But for somebody who is interested in mental health and they want to get more exposure, what advice would you give them?
It's very difficult to get exposure specifically just with mental health patients all the time if you don't work in the field, I must admit. It is ad hoc, but that's not to say it doesn't happen. I used to work in like I said, acute general hospital, and when I used to cover the medical assessment unit a lot, we had quite a few patients that came in with overdoses, whether it was insulin overdoses or whatever. And so if you think about it, mental health's all around you. You see it all the time. You just might not recognize it as such. I know that when I was working there, our priority was, make sure that they're safe, make sure the blood sugars are okay, make sure that they're hemodynamically stable and medically stable and fit to go home. And then we'd say, "Oh, refer to the psychiatric team because they've clearly taken an overdose." And I think maybe thinking a bit more about that kind of stuff and how you can read the notes that the like those liaison teams might write and things like that would be ways to sort of like build your portfolio and build examples of real life cases where you've seen, a patient come in and they're in a crisis or whatever, and they've taken an overdose or they've done this or they've done that. And that's one way to do it. I mean, it can be literally anywhere. I was in community pharmacy locum a couple of years ago, and a guy came in for like some counseling advice about like a diabetic drug or something like that. He was concerned about the tablets, and he wanted to talk to me in private. So I talked to him in private. And as the conversation progressed, he started telling me about like how his neighbors were spying on him and how he needs to go do something to save the world. And it became really psychotic, like in terms of his delusion and beliefs and stuff like that. And so having then to navigate that situation by getting him onto the call with like, the crisis response team via the telephone and decide, stuff. So it is all around you and you'll see it everywhere. It's just that you might not be addressing those points because you might think it's, oh, that's somebody else's problem, or that's all that specialities needs to deal with that. So I think, yeah, getting exposure can be quite hard from a patient's point of view because it is just ad hoc when the patients come in and you come across them. But I would say that there are lots of courses out there. There are lots of textbooks and resources that you can access. And like you say, obviously, you do webinars and things like that. So that there are resources about that you can get exposure to that will give you a bit more insight into the area, insight into the field, that might be helpful if you ever wanted to obviously apply for a career in mental health. And those things will go a long way. But it doesn't necessarily stop you. Like I say, I had no examples beforehand, and I got in, so it is possible.
Yeah, thank you for your answer. I think you put it very nicely when you said mental health is all around us.
Mm.
So you don't have to be an expert, you don't have to be qualified. There are opportunities for you to contribute. And again, the theme of this year is stronger together. So it might be your friends, it might be your family members. Do think about these situations as well.
Yeah.
And
Yeah.
to sort of close out this episode, do you have any final thoughts or key messages that you'd like to share with our listeners?
I would say that if you wanted to go into mental health, and even if you're not too sure, I would definitely consider it a go. It is extremely, extremely rewarding. And I probably thought the same thing that the listeners are probably thinking right now. I thought that 3 to 4 years ago. About mental health. I thought, well, I know a little bits here and there. It's a bit. I'm not too sure about it. It was sort of an enigma. But now I'm in the system, and now I've been exposed to it. I've done my rotations. I'm on courses for learning about mental health therapeutics and things like that. It is extremely rewarding, especially when you get it right. And to see those changes in patients, it's just amazing, and it does feel really good. Yeah, it does come with certain challenges about being careful on the wards and things like that. And there are unique things that are unique to mental health people might find challenging. But I would say for people that are really interested and really have a lot of a passion for making patients better and seeing those dramatic turnarounds, I would say it's very rewarding. So yeah, don't don't second guess it. Don't think, oh no, I'm not going to go for that because I'm not too sure. give it some serious thought, just as much as you would give cardiology or oncology or something like that, because it really can be just as rewarding sometimes, and if sometimes even more. I mean, pharmacists are well placed in mental health to make these decisions uniquely compared to other places. So if you really want to be one of those pharmacists that is at the centre of the MDT, that is making active decisions and making things better for patients, then I would definitely give it a thought. Yeah.
Thank you so much. I think, if not for our listeners, at least for myself, it has definitely inspired me to get some sort of exposure to mental health and try and
Mm.
get a rotation or two within my
Mm.
training year this year. But I really appreciate you joining us, Ashley. Thank you so much for your
All
insights
right,
and for
my
giving
pleasure.
us a bit of a taste of what it's like to be a mental health pharmacist. I hope this episode has been inspiring for our listeners, and maybe one or two of you out there who have been considering mental health, this is your push to get into the field. Do keep your eyes out. There's plenty of other activities going on this week with Mental Health Europe. So there'll be plenty of webinars, workshops for you to take part if you are interested. Have a look on their social media and on our social media as well to follow along during this week. Thank you and see you next time.